The Steroid Metabolome Analysis Core is a research facility that looks at small molecules. We want to improve what is already out there clinically, which will help aid diagnostics in various diseases.
We're a team of scientists at the University of Birmingham. We look at steroids that are important in lots of areas of metabolism: stress response steroids, steroids that control your blood pressure, and steroids that are involved in muscle mass and fertility. We measure these using a technology called mass spectrometry.
The scientific output from our lab has a large societal impact. We aid in providing information towards clinical settings and also working with companies for drug testing.
We've recently developed a test for adrenal cancer, and this helps us diagnose whether a patient has a benign, a non-cancerous, or a cancerous tumour, and that's just by looking at their urine sample. So we hope within the next few years this will be used in clinical biochemistry, so patients will have a more sensitive and specific diagnosis for adrenal cancer.
A previously unexplored group of molecules that we have been interested in is estrogens. This has been very difficult to analyse. With our old GCMS system, the system was just not sensitive enough for the analysis of these compounds, and trying to analyse them on our LCMS system has come up with multiple issues due to their poor ionisation ability. The new GCMS system is sensitive enough that we can accurately quantify these molecules. We're probably one of the first labs to look at these variety of estrogen metabolites in such depth. And it's really important that we look at these more female-centered metabolites and not just the ones that are easy to analyse.
We've now come to a process where we've got a piece of equipment that is forefront to our work, allowing us to look at molecules that we couldn't look at before. Currently, we are able to go through double what we could do before because of the speed of the new Shimatsu system and the capability it has to be able to do a full spectral scan and a single scan at the same time. It's intuitive, it allows us to look at our data as a whole and then aids us with doing the data analysis in a way that we can use it and work with.
The survey mode within the Insight software is a really helpful tool, and it allows us to look at a number of peaks simultaneously to make sure we're getting consistency across our analysis batch, which we haven't actually had an ability to do before.
The customer service experience that we've had with Shimatsu has been excellent. That is one thing that was extremely important to us, and provide us real-time feedback, but also work with us when we want something tailored to our needs. There was a both-sided conversation where we could sit down and go through things that were important for us, allowing us to be confident that it was going to work for us.
The Steroid Metabolome Analysis Core runs lots of research. We have good clinical practice accreditation. This allows us to work with clinicians to run clinical trials and research based on population studies. GCMS is really fundamental to our research. It allows us to look at lots of things in one go. So our Shimatsu GCMS at the moment looks for 34 steroid metabolites, and that covers all classes of steroids. So this gives us a really holistic view of what's going on in steroid metabolism. When a clinician or a researcher approaches us, we use it as that first level of analysis. We work from the conception of their project, so which steroids to look at, which mass spectrometer and which biofluid, and then together we look at the data, and that allows us to generate that high impact research.